Setting up the table. The easiest way to move the table is on its wheels. The wheels and the locking wheel pins are found in the cardboard box. With one person lifting an end of the table, a second person can insert two wheels and lock them with pins. Repeat this process on the other end of the table, and the table can be wheeled into place. When the frame is flush to the floor, the table is 21.5 inches tall. There are 4 brass adjustable feet in the cardboard box that can be used to raise the table an additional 1.5 inches approximately. Remember to remove the lift rods before plugging in the electric headpiece motor. The headpiece motor foot switch is commonly placed on the floor underneath but slightly in front of the headpiece mechanism. It is advisable to tape the cord to the floor, but please leave enough cord slack to allow the headpiece to go into complete elevation. If you ordered the electric elevation motor on your table, the foot switch can be placed just next to the headpiece foot switch. Once again, taping the cord to the floor is recommended so no one trips. An electric power strip can be placed on the floor inside the frame just in front of the electric elevation motor. Both motors could be plugged into the power strip, and the power strip would then be plugged into a wall outlet. The primary advantage of a power strip is that only one cord would run from the table to a wall outlet. If you have the ability to use a floor outlet, this would eliminate any power cord running to a wall outlet. How to use your table safely. It is expected that the chiropractic practitioner using a PCT table is trained and qualified to use such a table in a responsible and safe manner. PCT is designed as cervical instrument adjusting fulcrum option on its table. This option was designed for the sole purpose of postural correction using the impulse adjusting instrument. It is necessary to use caution when raising and lowering the cervical instrument adjusting fulcrum. To raise or lower the cervical instrument adjusting fulcrum, spread your right thumb and index finger to contact the padded strip while releasing the lever with your left hand. In this manner, you can slowly raise or lower the cervical instrument adjusting fulcrum and lock it in place at any elevation by simply releasing the lever. Do not elevate the cervical instrument adjusting fulcrum when a patient's neck or head is immediately above it. Have the patient raise up high enough before elevating the cervical instrument adjusting fulcrum, and then position the patient on the cervical instrument adjusting fulcrum. PCT has attempted to eliminate or reduce as many pinch points as possible. Common sense and caution are expected to be used in any potential pinch point areas of the table, including under any of the pads, under the electric elevating headpiece, and under the moving carriage of the table that is equipped with the electric elevation motor. The thoracic and lumbar cocking handles are ergonomically positioned for use. Caution should be used when approaching the table where these handles protrude in order to protect your legs from bumping into these levers. In some instances, it's best to straddle the thoracic and lumbar cocking handles with a leg on either side. It is recommended that the practitioner informs the patient of the above stated safety concerns so as to familiarize the patient with the table, attempting to prevent any mishaps. When in the prone position, make sure the patient is trained to place both hands on the semicircular pads. Use of your PCT table. The PCT table was designed to perform certain functions that no other table performs. These unique functions require the practitioner to relearn how to use their new table. The learning curve for this table can be greatly reduced by paying attention to the following points. The polyurethane pads. This new material will not lose the integrity of its density as upholstered foam does. It is expected that PCT pads will last for years of reasonable use. The densities of the pads have been designed to maximize the pre-stress needed for optimal mechanoreception and thus maximal neurological correction. Therefore, the practitioner needs to apply a force to the spine to take up slack in the polyurethane while following through to complete that drop. Using the headpiece. The PCT headpiece is raised and lowered electrically. While remaining horizontal, the headpiece can be lowered 3 inches below the thoracic piece, 19.5 inches from the floor. It can be raised 8 inches above the thoracic piece, 29.5 inches from the floor. When standing at the head of the table, the practitioner can pull on the black plastic cylinder release lever on the right-hand side of the headpiece to allow for flexion and extension of the headpiece. The headpiece can be moved into an unprecedented and usable 30 degrees in both flexion and extension. To manually cock the headpiece, pull up on the bilateral cocking bar with black foam handles. Some PCT models can be favored or biased to drop cephalad or caudad. Other PCT models will only drop cephalad. If your model drops both cephalad and caudad, it is required that the practitioner favor or bias the headpiece cephalad or caudad prior to use of a drop. Tension setting. All PCT tension knobs, except for the headpiece, are bilateral. Each tension knob covers the full spectrum of tension in just 2 1/4 turns. On the lowest tension setting, the weight of the table pads themselves is enough to cause that section to drop. At its highest tension setting, the headpiece requires a high amount of force to get the section to drop. It does not require much rotation of the tension knob to create a great change in tension setting. To ensure complete function of the headpiece when it is in extension, it is necessary to make sure the cervical instrument adjusting fulcrum is fully depressed. Using the thoracic and lumbar pieces. The thoracic and lumbar drops are mounted on a single plate and can be raised to 55 degrees above horizontal. The thoracic drop is a flying drop. This means the thoracic piece can be cocked and dropped at any angle. When your table is equipped with the standard lumbar handle cocking device, the lumbar piece is also a flying drop. If your table is equipped with the optional lumbar foot pedal cocking device, the flying drop is then replaced with a lumbar drop that only functions in the horizontal position. Using the pelvic piece. If your table is equipped with the standard pelvic hinged drop, it is either cocked with a standard handle cocking device or optional foot cocking device. If your table is equipped with the optional pelvic elevation, it will come with a foot cocking device only and can be cocked and dropped in any position. The manually operated optional pelvic elevation piece elevates approximately 8¼ inches above horizontal. Using the leg and foot pieces. The leg and foot pieces are mounted on a single plate and can be raised to an angle of approximately 60 degrees by releasing the black plastic cylinder release lever. The foot piece can be extended 6½ inches on telescoping rods to accommodate different height patients. General comments. If your table is equipped with an electric elevation motor, it can be raised to a maximum height of 29½ inches off the floor when the frame of the table is flush to the floor. The black plastic cylinder release levers operate every section of the table and are bilateral except for the headpiece, which has only a single lever on the right side. When the lever is depressed upward, it releases a gas cylinder to quietly and smoothly raise, lower, or angle and lock any section of the table. If you place your thumb on any round black nut and pull it out on a plastic cylinder release lever, you will be able to change the position the handle locks in. It is essential to have enough travel between the handle and the bottom of any section of the table in order to release the cylinder and allow for movement. Many practitioners are concerned with cylinder failure when in actuality the cylinder has not failed. The handle is probably in the wrong position, not allowing for enough travel to engage the cylinder. When the tension knobs are set to their fullest in the thoracic, lumbar, and pelvic sections, you will find that you will probably not be able to drop that section. When the tension knobs are set in their lowest position, the weight of the corresponding piece will drop itself. Taking care of your PCT table. The polyurethane pads should be washed with mild soap and water. Rinse any remaining soap residue off with clear water. Periodically, the drop mechanism pins should be greased. Troubleshooting points. The headpiece will not elevate. Check all the plugs relating to the foot switch and the motor. The table will not elevate. Check the plug related to the elevation motor. A section of the table will not elevate or angle. Check the position of the black cylinder release lever and make sure it is set to accommodate sufficient travel and ensure proper cylinder engagement. A section will not drop. Reduce the tension setting on the tension knob. Headpiece will not drop. Reduce the tension setting on the tension knob. If you have the table with the headpiece that can be biased cephalad or caudad, make sure you bias the headpiece one way or the other after cocking the headpiece. Table specifications. The weight of the PCT table is approximately 325 pounds, of course dependent on which options are on the table. The height of the table, when stationary, the table is 21½ inches off the floor when the frame is flush to the floor. The electric elevation table will travel from 21½ inches off the floor to 29.5 inches off the floor, again when the frame is flush to the floor. The width of the table is 21 inches at its widest. The length of the table is 77 inches. Congratulations on the purchase of your new PCT table. It is a professional piece of equipment that was designed by doctors for doctors to perform certain functions that no other table performs. Your PCT table should allow you to deliver superior care for thousands of patients for years to come. Thank you.